Hi guys, I'm super excited to bring this webinar of functional medicine and our approach to breast cancer to you guys, not only because it's October, which is Breast Cancer Awareness Month, so a perfect time to shed some light on this, but also because cancers, especially breast cancer, is on the rise. And despite what some people might believe, there are actually things that we can do to help minimize breast cancers and therefore help prevent them to some degree. So I wanted to share this information with you today with a short little webinar. So I'm just going to go through quickly what breast cancer is, how some of the hormones can influence breast cancer, and then start going into the Dutch test, which is a test that we offer at our clinic that you can perform at home, and we're able to interpret those results with you and help create a customizable treatment plan for you and your needs. And then we're also going to go through some updated guidelines to breast cancer and then send you with some things that you can actually leave here and start doing to reduce your risk of breast cancer and improve your hormone health. So breast cancer affects about 1 out of every 8 female globally, so all throughout the world. And it is one of the most common cancers and one of the highest causes of death in women. There are certainly genetic factors that can predispose us to breast cancers, which is what a lot of people are most worried about, but that can only make up about 5 to 10% of cancers. So certainly we have to worry about those genetic factors, and that's also where we're going to see some help with the Dutch test, but not all breast cancers, not even half of breast cancers are genetic, which means that there has to be an environmental and other lifestyle influencers and impactors on that. And so there are things that we can do to prevent that. We can change our lifestyle, we can improve our environment, we can use routine testing to help catch things and make improvements before they become a problem. So I'm not going to get too deep into the weeds of estrogen and exactly all of the roles it can play, because I understand that can be a little bit difficult to follow. However, it's important for you to know that not all estrogen is created the same, and estrogen isn't just estrogen. There's various forms of estrogens in our bodies, and then the way estrogen breaks down those metabolites, that's what can be a problem. So sometimes somebody may have their estrogen checked and it might not be reflected as high, but can still be problematic based off of what it's doing in our body. So there's 3 main metabolites: your 2-OH, 4-OH, and 16-OH. 2-OH are the good guys. That's our protective estrogen. We're not really worried about that, and we want to have plenty of that. But the 4-OH, that's kind of one of the bad guys. If we don't detoxify that properly, that can bind to our DNA and cause damage and increase our cancer risk. And then 16-OH can be somewhat of a wild card estrogen, and that can also increase our risk of estrogen-sensitive cancers. And you see high levels of this 16-OH oftentimes in people that have proliferative conditions. So people who have PCOS, endometriosis, adenomyosis. So if we're detecting that this level is high, we want to start working on things to reduce that so that it's not going to increase that likelihood of the estrogen-sensitive cancers later on. And how we're learning all of this is through a test called the Dutch test. So the Dutch test stands for Dried Urine Test for Comprehensive Hormones. It's exactly that. It's a urine test and a saliva test that you do at home so that you can be very, very specific on the timing and very specific on the collection. Much easier than having to come in to the lab. Why we do this is because hormones do fluctuate. Hormones fluctuate throughout a menstrual cycle, which is why women will get periods, why they will ovulate at certain times. All those hormone levels are going to be different, so we want to make sure we're testing that appropriately, as opposed to just coming in and getting a blood draw on any random day. It doesn't give us the full picture. So it's going to be helpful to identify those hormone imbalances that certainly could be putting us at risk of estrogen-based cancers like breast cancer, but also help to identify what could be causing issues that we're experiencing like PMS, menopausal symptoms, infertility, fatigue, essentially anything that could be related to hormones, and some we can learn through this. And so why that's important is that we can assess how estrogen's breaking down. So if you do a blood draw, you're not going to learn what your 2 or 4 or 16-OH is. So you're not even going to know if that's a problem. You're only going to know what your estrogen is. So you're not getting the full picture. So this test is going to give us that. It's going to help us see how the person's breaking down that estrogen, how they're getting rid of it. So then we can use really targeted therapies like supplements and lifestyle changes to help address those things. So this gets a little crazy, but this is what the sheet, one of the sheets in the report of the Dutch test looks like. And I want to just zoom in on one feature, just the feature that we're talking about a lot here, the estrogen. So if you can see my mouse, possibly, the test will test for E1, which is estrone, that's one estrogen, E2, which is estradiol, which is our most prevalent estrogen, and then estriol, E3. So those are your 3 estrogens, but then it's going to take it one step farther and test your 2-OH, 4-OH, and 16-OH. And so I pulled this example because you can see this person has a lot of this 4-OH. They don't have high estrogen. See, this E2 is not high. So they're going to maybe get overlooked in a lot of scenarios. They're not going to be advised to do lifestyle changes because they don't have high estrogen, right? We're not thinking it's a problem. Well, wrong. They have a lot of this 4-OH, which is the kind that binds to DNA and can cause damage and increase our cancer risk. Now, if I remember correctly, this patient actually has a family history as well of breast-related conditions. So this would be a prime example of somebody that, because I believe this patient's pretty young. I think she's in her early 20s. So this is a prime example of somebody who we want to start some interventions on. Maybe start reducing their exposures to toxins, start reducing their exposure to estrogen toxins that can increase those estrogen levels, start adding in some supplementation for regular detoxification, change up their diet a little bit. If they needed to, help them lose weight because adipose tissue, fat tissue also creates and holds on to a lot of estrogens. So we want to start implementing all those things as soon as possible with this person. And then it really is also important to make sure that we are detecting things early, which is why people will do the Dutch test and why it can be helpful is because oftentimes people aren't coming in and doing this when they have breast cancer, but they're coming in because they have PMS or because they have irregular menstrual cycles. They have other things going on that this information is then going to be useful. You can understand your hormone levels and start making those changes. You can get on a specific treatment plan for what you need because there are so many supplements out there that are labeled to balance your hormones, to help with menopause, to help with menstrual cycles. But what if it's the exact opposite of what a person needs? That patient that we just looked at, there are supplements that person should not take because their estrogen is low, and other things that they should take to help with that 4-OH. So just picking up some random run-of-the-mill hormone balancing supplements are not going to be beneficial for everybody. And then you can also progressively monitor the estrogen levels. So let's say this person did a test when they're 24. They could do it again when they're 25 if they were in the middle of a treatment plan, but they could do it again when they're 30, when they're 35. We can do it again at certain time frames and then be able to monitor that over time and see if what we're doing is working. I also wanted to shed just a little bit of light, since we are in Breast Cancer Awareness Month, on some of the updated guidelines. So previously you used to start doing mammograms, or it was recommended to start mammograms at 50, which is now moved up to age 40. So because breast cancer we're seeing it more and more often, and because medicine has progressed, it is recommended to try and catch that sooner. So the guidelines have moved up to 40, which is great because it's hitting those people that are at greater risk already. But it's also beneficial to perform a monthly self breast exam and make sure you're getting your yearly breast exams by your physician as well. So I wanted to leave you guys with some strategies that you can start implementing just to reduce your breast cancer risk as well. So you want to start supporting healthy estrogen metabolism. What that means is basically your body is ridding itself of the excess estrogens as opposed to letting them just recirculate and keep swimming in our body and cause issues. So we can do so by eating cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, cabbage, making sure we're getting plenty of fiber. I like to tell people to shoot for 35 grams a day, and then make sure that we're lowering alcohol. Less is best. Managing our stress and cortisol levels. So cortisol is another hormone that a patient will learn about in the Dutch test. And so in order to help manage their cortisol levels, we recommend implementing mindfulness practices like meditation, yoga, breath work, exercising regularly, aiming for at least 30 minutes most days of the week. 30 minutes, 5 days a week is a really good goal, and making sure we're getting quality sleep and sticking to a good sleep schedule. Your liver is responsible for a lot of detoxification, so making sure that you're supporting your liver through liver supporting foods like dark leafy greens, garlic, turmeric, and then all those cruciferous vegetables that I mentioned before are going to be good. making sure you're maintaining a healthy weight. As I mentioned before, fat tissue holds on to hormones and it actually can create hormones. So essentially, sometimes a person who has more body fat, they may have higher estrogen levels. So we want to make sure we're maintaining a healthy body weight. And then also, if you have lost a lot of weight, that body fat tissue, as you get rid of it, it kind of releases those things into our body. So that's where oftentimes supporting detoxification, supporting those detox pathways can be helpful, especially if you're on a weight journey. And then considering key supplements, which is what I recommend doing with a health professional. So with us, with somebody at our clinic that can help you be specific and make sure you're taking the right things. DIM is used over and over again for balancing hormones. But my only issue with DIM is you don't want to take it if you have low overall estrogens. So it's a great product, not great for everybody, but DIM is going to be great for detoxifying some of those poor metabolites. Calcium D-glucarate is a product that helps support the liver. And these are products that you want to use targetedly and specifically, just as you would a medication. And so like I mentioned, some of those supplements, hormone balance is what we use. A lot of times it has DIM in it. Sulforaphane comes from broccoli extract, and we use that a lot for detoxification across the board, but especially for detoxification of the estrogens. And then calcium D-glucarate also is very effective for estrogen detoxification. Functional medicine really is kind of cutting edge and at the front of this because it is one of the best approaches to help you reduce your risk of these significant conditions, acute conditions and chronic conditions. So to help reduce your risk of developing some of these cancers and also help managing your health if that is something that does affect you at some point in life. So it's going to help give you a personalized hormone balancing treatment plan, address gut health and detoxification, optimize your nutrients. Those areas are all important because if your gut health is poor, if you're not absorbing nutrients properly, you're not detoxifying properly, all of the things you're doing and taking aren't going to be able to actually impact your health as the way that they should. If you're nutrient deficient, so if your iron is low, if your calcium, magnesium are low, you're going to feel poorly, you're fatigued, you're not going to be able to do the things that you should do to maintain the healthy weight, help with your cortisol levels, help with detoxifying. But then also, if you're low in protein and low in carbs and low in fat, like your diet isn't there, then everything you're doing also is going to not be able to impact you as it properly should. So optimizing those nutrients are going to be key. But then also on the other side of things, not forgetting about the other pillars, like managing your stress and balancing chronic stress hormones as well. Some people like to overlook the fact that stress is a factor and that that's an area of our health that we need to address. So helping you create mindfulness practices and implement those on a regular basis are going to be important. Giving you environmental tools so that you can reduce those toxins. A lot of us live in a very toxic environment. Even if we're not bombarded with these heavy chemicals, we're still bombarded with toxins all day, every day. From the things we put on our body to the things we put in our body, toxins are very, very prevalent. So helping you with environmental toxin reduction is going to be a huge key with functional medicine as well. And then, like I said, the testing is key to help detect things early and get on top of a treatment plan as soon as possible. So like I said, October is Breast Cancer Awareness Month, and this is a perfect time to start bringing this topic up, but it doesn't just stop after October 31st. We have to be constantly thinking about our hormone health, how that impacts us, and how that can reduce the risk of developing breast cancer. So feel free to reach out to myself, contact our office to get set up for a consultation and discuss the Dutch test or other forms of testing that may be beneficial to you so that we can make sure that we're addressing your health now and in the future.